So I've taken a little break from social media, partially because I've been sick, which is why this, but partially because I've been in a spot where I've just been kind of frustrated with medicine. I've been frustrated with the structure of our medical healthcare system. I feel like in med school, they should teach doctors about the system, and they should teach them and equip them with tools of how to make positive change. Like what to do when you're faced with accessibility to care issues, and you see someone who desperately needs help, and because of logistical nightmares and other things like that, there are barriers to helping them. Like that shouldn't happen.
Hello everyone, this is Emmanuel Cook. We will be reacting to a new video today, so make sure you guys like, comment, and subscribe down below, and let's get into the video.
There's one thing that I really try to remember as a medical provider, especially now when everyone is so sick during this time of year, is that everyone's reality is different, and the way that they perceive pain and illness is so different. So being in the medical field, you hardly ever see patients when they're happy. They're coming into you because they're sick, and they're explaining their symptoms to you, like sore throat, fever, whatever it is. And I've noticed that I've become, in a way, relaxed and not very fazed by it, because so many people every single day come in telling me the exact same things. So over time, it almost diminishes it and just makes me feel numb to what someone is telling me. And when I feel myself having the tendency to brush off their symptoms or diminish them a little bit, that's when I take a step back and I remember this person came all this way to come see me because their reality was that they didn't feel well and that they were sick. And even if I perceive or interpret their symptoms as mild and not a big deal, they clearly don't. Which also is very difficult to distinguish when someone's experiencing physical pain, because pain is solely subjective and extremely hard to explain. I'm just really proud of myself that I'm even recognizing this, because it is very unsafe to practice medicine in a state of being too comfortable. Practicing with this mindset keeps me on my toes and does not let me get too relaxed to the point where I would miss something potentially really dangerous. Also, from a patient's perspective, I recently was sick myself and I felt horrible. I realized that all I really was yearning for was validation from someone else that I was okay. And I'm not saying that we should operate in a capacity of fear. All the patients really want is just validation and for you to take them seriously. Job is to listen to them, not write them off, not minimize their complaints, and be able to kind of pick up on what they're trying to tell us in the best way that they can express it. In the same breath, you can kind of be teetering on a fine line between taking complaints seriously, but also encouraging hypochondriac tendencies, which can pose a big problem as well.
The greatest and saddest irony about becoming a doctor, or any healthcare worker really, is that you enter the field to help improve somebody's health. And that also entails working with people and interacting with them. And you go into it because you like that. You don't go into healthcare because you hate dealing with people. But with all the craziness that happens with a lot of non-compliant patients and aggressive patients and a crazy healthcare system where you're just rushed and burned out and short on time, it ends up taking a toll on your own health. So to make other people's health better, your own health suffers both physically and mentally. You end up gaining weight, you eat junk food, you stress all the time, you don't sleep properly, and on top of that, because of all the craziness of dealing with people, you end up actually not wanting to deal with people after a certain point.
One of the most frustrating things as a doctor is having this skill set where you can solve some of the most complex medical issues, but then still not being able to give your patients the basic necessities like food, money, or shelter. Yesterday, I saw one of my regular patients in clinic, and I've seen him regularly over the past year and a half, but yesterday his energy and aura just seemed off, and his blood pressure was super high. And I was like, yo, what's going on? How are you feeling? He said, I'm not having a good time of it. Essentially, he opened up that he's been unhoused. He's living in a trailer that is essentially unlivable. It has no running water, electricity, or heat. He's not able to shower or bathe there or use the toilet. And I was just flabbergasted because I was getting ready to, kind of come down on him about his elevated blood pressure in nearly 200s, and he's not even having running water to take his medications. Unfortunately, his phone is cut off and we have no way to contact him and reach him. So I'm like, once you leave this building, once you leave my office, I theoretically will not be able to contact you. I went to the break break room, I got him some like leftover lunch that was there, some pizza, some french fries. He ate, he drank, while I came up with a plan and essentially said, come back in the morning, just come back to the office, right? Since we're not going to be able to call you, come back to the office and I'll come in the lobby and meet you. Oh, I was supposed to be working from home today. I didn't need to come to the office. I'm not seeing patients. But this is the part of doctoring that you don't get, right? This is the hidden curriculum that, yes, this might not be in my hours, right? My 9 to 5 or what my clinic schedule is, but this is within my scope. So I put together a little bag of essentials from home. I stole a pair of pants from my partner. I put in a new shirt, some socks, hand sanitizer, soap, and I went to Dunkin' Donuts and got him some hot food for breakfast as well as some donuts and muffins to hopefully tie him over through the day. I spent this morning calling around to the social worker as well as some different resources throughout Philadelphia. And my plan is that I'm going to send him to the hospital since he does have uncontrolled medical problems. And from the hospital, he's hopefully going to be able to get some temporary housing for people with complex medical needs that don't have housing. So hopefully this is a success. It's temporary, but it's something. So whenever you think that something is not within your scope as a doctor and that you're just here to write medications or diagnose problems and things like that, always think about the social issues and those social determinants of health that you can actually do something and contribute to for your patients, as well as just continue to create good relationships and rapport with your patients so that they feel vulnerable and comfortable enough to tell you what they're actually experiencing at home.
As a doctor, there come times in your life or in your day where you're just like, you just have to accept that there is more work to be done than you can physically do in one day. And then you just need to take a pause, go to bed, and come back to it the next day. Today was my admin day. That means it's the day that I'm supposed to take the time to sit down and do all of my non-patient facing like tasks, refilling medications, doing notes, responding to patient messages, refills, all the things. I can't even think. And that's what I did. I spent most of my day sitting on my butt doing that after a workout and a couple other things. And still, I am nowhere near done. I still didn't get half of the stuff done just because it takes time. Every refill means I need to review a patient's chart and look at, okay, if I'm refilling this diabetic medication, when was the last time they had an A1C done? When was the last time they had a renal check? When was the last time I saw them in office to do a diabetic foot exam and diabetic eye exam and make sure that everything else that I need to monitor about their diabetes is also on track? It takes time. That one task can take up to 15, sometimes even 20 or 30 minutes. There is just not enough time in the day to do what needs to be done the way that the American healthcare system wants us as doctors to perform based off of this productivity stuff. And it drives me up the wall. But I do love my job. I'm grateful to be able to do my job. And sometimes as a doctor, you just have to take a pause, go to bed, and come back to it the next day.
Welcome to this episode about why it sucks to be a doctor sometimes. So if you know me, you know how much I love my job. I'm an OBGYN physician. I love delivering babies. I love taking care of my patients, and it's an extremely rewarding career. But there's some stuff about it that, like, sometimes it's just a little too much. Today's topic is malpractice insurance, and specifically tail coverage. So as a physician, I have to get malpractice insurance every single year. I pay for it. Well, actually, currently my employer pays for it, and that basically covers anything I get sued for while I'm working. Sometimes it's not even necessarily something I did wrong, but a patient can always sue you, and you still have to pay to defend yourself, right? So when you're with a malpractice carrier, an insurance company, and then let's just say you want to leave your job and you want to go to another insurance company, your job requires you to purchase what's called tail coverage. And tail coverage is like a package that you purchase that then will give you coverage in the future for anything that you get sued for from when you were employed by them. So let's just say I deliver a baby tomorrow and the parents want to sue me 5 years from now, but I'm not working for this company. That's where the tail coverage comes in, and I had purchased a tail coverage that would then cover me for that. So I recently inquired about what the cost of my tail coverage would be if I decided to leave my job today. And I've only been out of residency for almost 3 years. So 3 years of practice If I decided I wanted to leave, I would have to secure tail coverage, and that tail coverage would cost me $130,000. And that would have to be paid within, like, I think it's 30 or 90 days of me severing my contract. Now, I don't necessarily want to leave my job. It was really just an inquiry because I like to know where I stand in different situations all the time. But, like, could you imagine if I did? Like, if I hated my job and I wanted to go somewhere else, or if I decided I wanted to move, or if I just anything, like how devastating that could be to somebody. And before people get on here and talk about how, well, you're a doctor, you make so much money, you can afford that. $130,000 is more than half of my salary. And that's before taxes. Because as a single woman in the United States, I get taxed like no tomorrow. And on top of the already $500,000 in student debt that I have, to be able to become a doctor, to then have to pay $130,000 for tail coverage. So just, thought I'd shed some light on that.
I will never tell y'all not to go to medical school or dissuade anybody from doing this, but if there's anything else you even remotely might want to do, just, explore that. Please do. Because I've been on my surgery rotation, and I know, like, when I first started, I, got on here and I was like, oh my god, it's so fun! The switch up was real. That first service was really great. This one I'm on right now, I'm exhausted. I've been having to get there at like 4 o'clock, like 4:30, 5 o'clock in the morning. Yeah, staying till like 5 in the evening. Yeah. When I have to go in for 6 a.m., that's sleeping in now. Yeah. I can't tell you how many times I've reread my personal statement this month to remind myself why I want to do this. I have cried multiple times, sometimes for no reason, just because I'm exhausted, because after you get off, you have to go home and study because there's a test at the end of this. So I'm constantly reminding myself why I wanted to do this. And luckily I'm on this rotation with one of my really good friends, and the residents we have are really nice, so that helps a lot. But all that to say, I have a really strong why for why I want to be a doctor, and I am learning every day that I'm there, and I'm grateful for this experience, even though it really sucks right now. So take the time that you need to make sure that this is for you, because that's something I definitely did as a pre-med. I was like, maybe I want to be a dentist. Shout out a dentist. I was like, I don't like the mouth. I thought I wanted to be a vet. I worked as a vet assistant. I was like, can't see dogs die. Yeah, so I explored everything that I was interested in. So while I'm here, even though this sucks right now, I know there's not really anything else I'd rather do. And I just have to get through this, and it's gonna be okay. So explore your options. There's nothing wrong with that.
A quick reminder, please remember to like, comment, and subscribe down below, and let's continue the video.
Do I get burnout in my job as an internal medicine hospitalist? The answer is sometimes, yes, but probably not for the reason that you would think. It's actually not because of the volume of hours worked or even the odd hours worked. I have a pretty decent schedule in terms of hours that I work in a month. So when I'm on wards, it can be a lot of hours. I can be doing not much else besides working, and sometimes I even work weekends. But I know that probably the next week, I'm going to have a really chill week, and I'm going to make up for it. I'm going to sleep, and I'm going to do all my life stuff, and it just really balances out. So I would say from a volume worked, no, I don't get burnout. If there's one thing that does burn me out, though, it is navigating a non-functioning healthcare system while taking care of patients who do not have a lot of resources. The vast majority of my patients either don't have health insurance, they have Medicaid health insurance, and they're in a Medicaid HMO, which is most of the time incredibly difficult to deal with. I feel like half the time I am bending over backwards just to get my patients basic care, like basic outpatient follow-up, the bare necessities when it comes to needed medications. And so a lot of times just trying to work with the insurance companies, the case managers, the social workers to get patients what, in my medical opinion, think they actually need feels like it's clawing my way uphill. But until we have a universal system, there's going to be people who are in these insurance plans that don't want to pay for stuff easily. I'm not sure that's unique to hospital medicine, though. In fact, I'm sure it's not unique to hospital medicine. I think you'd find that in a lot of specialties. It's a function of the healthcare system. I'm not sure it's a function of just being in my particular role as a hospitalist, but I hope this helps.
So I have an idea. Instead of shaming burned out doctors who choose or in some cases are forced to go part-time for their own mental health, like this commenter and so many others try to do, let's dig a little bit deeper. Why is a full-time career in medicine incompatible with having a relationship, a family, or a life outside of medicine? Why are over 60% of doctors burnt out? Why do up to 30% of doctors in training suffer from depression? And why does a doctor die of suicide every single day? Let's answer those questions instead of blaming doctors who are just trying to figure out a way.
Being a doctor is one of the most stressful jobs that you can do. It is an extremely stressful field to work in. Extremely stressful. The hours are just insane, like 80 hours a week and stuff like that. So as for me, I would never ever go into the medical field at all.
Is there anything good about studying medicine? I feel like right now with the current discourse of a lot of doctors and other healthcare professionals leaving healthcare, it makes you really wonder like why people do it and if there's anything good that comes out of it. I thought now is as good a time as ever to put my reflections of medical school as a student that's graduating in July. And I thought I would start off with a positive note, since we all know that there is not enough of that on this app. The number one thing that I got from medical school is a sense of confidence that I can do anything that I set my mind to. And what I mean by this is not necessarily that I will be the best at doing whatever I try, especially if it's something new, but I mean that if I put enough blood, sweat, grit, and tears into something, I will do it. There is nothing keeping me back. If I need to change a tire, I will learn how to do that. If I need to start woodworking, or if I want to start woodworking, I will do that because I want to, and I will learn, and I can teach myself anything. Medicine in general requires a lot of resilience on the part of the student that is learning. Even if you're someone that has a photographic memory, which I'm not, and that really grasps concepts easily, it's still very grueling and taxing to just like have to study long hours and lots of material. You end up having a really good sense of accomplishment, especially for me. It was when I was in my clinicals and I could really apply the things that I had learned well. And this wasn't in my third year. This was like most of it was in my fourth year when I finally knew what I was doing in the clinicals and I could focus on the knowledge I had accrued during the last 3 years. So I hope that uplifted anyone that was feeling some ways about medicine, and like for part 2.
Medical training can be extremely toxic, but I had a resident tell that when they were on their ICU rotation, it was them and another resident. The attending would make them flip a coin to see who would go home on time and who would have to stay. They're not leaving at like 5 p.m. They're already leaving at like 7, 8 p.m. Thinking about that gives me anxiety. That's so rude and it's so wrong, so unnecessary. It creates animosity between two residents. Definitely does not promote the camaraderie in medicine. It just ruins your day. You already have zero control over anything in residency, and now you're gonna add more games to the day. As a resident, you can't even say anything, right? You just go with it, and if you flip heads every time and the answer is tails, you get to stay. I just feel like there are much better ways and more conducive ways to enrich medical training, and toying around with schedules and unnecessary anxiety is definitely not the route. Some attendings are just sick in the head and they find that to be funny, but personally would never do that. I'm so shocked that this is even a thing, and it sounds like a small thing. When you're in your residency training and you're on ICU and you're tired and you're stressed, one more thing that you no longer have control of, which is the time you leave, literally make or break you. I don't know. I personally just feel like just give me a schedule and stop playing games. Like, I was shocked when they told me. I was like, that is so wrong.
The scariest thing I see as a neurologist is the gradual weakening of America. And when I say weakening, I mean muscle weakness. I see my patients who continue to get weaker and weaker because they don't use their muscles. Not using your muscles and not moving not only has effect on your body, but has effect on every aspect of your life, and most importantly, your brain. So that's one of the scariest things I see as a neurologist.
Jen has the right idea. If you're a family medicine physician or a doctor that's completely burnt out and you're thinking about selling out, but you're like, oh my God, I can't sell out. I don't want to be a sellout doctor. I don't want to work for insurance companies and like do peer-to-peers and deny care. She's like, I'm thinking something better. I'm gonna Trojan horse this insurance company. MRI, go. Endoscopy, go. Head to toe genetic testing, go. I like this idea. But also, if you think how crazy it is that as a physician, we have to like get on the phone with another physician and be like, can you please let me do my medical plan with my patient? Can you please let me make medical decisions as a physician for my patient? What the fuck? The worst for me is all the things that get denied because I do them as a family medicine doctor, and they're like, well, you need a neuro referral to prescribe Nurtec. Jen has the right idea.
I don't know what non-healthcare worker needs to hear this, but nurses are not the only people that wear scrubs. It's always so awkward when I go somewhere after work and I'm in my scrubs and someone's like, oh, what kind of nurse are you? I'm not. I'm a dietitian. There's more people in the hospital that wear scrubs than just the nurses. Dietitians, doctors, patient care techs, radiology, CT ultrasound techs, phlebotomists, medical lab assistants, all of the therapies, respiratory, speech, occupational, physical, even the social workers and case managers wear scrubs. Like, it's so much more than just nurses who wear scrubs. Like, everybody in the hospital wears scrubs because they're just more comfortable. They're like work pajamas.
Does anyone have some advice on how you just generally stay positive and not catastrophize about your future healthcare career? I know that I'm a resident, a first-year resident at that, and I'm still learning. However, literally every mistake I make, I feel like I take to heart, or anytime like I think that it could be this, but then it's actually this, but then I also should have considered this, I take it to heart. Not that I don't want the constructive criticism, because I need it. I need it to learn. That's what this is all about. But I feel like I have a hard time recovering from realizing that, like I know I'm not yet supposed to be at the point where I can fully independently practice, but then I'm also panicked because I'm not yet at that point, if that makes any sense. Like, I just want to be a good provider to people, and I'm really scared of missing things. And I know that realistically, physicians aren't perfect people. No one in healthcare is perfect. And people don't present the way exactly the way that we're taught. And you can do all the right things and still miss things. However, that still freaks me out. And I'm like worried that I'm going to royally screw up at some point. And like, I feel like whenever I make a tiny mistake and there's a tiny learning point, it sits with me, and it shouldn't. It should be like, okay, noted, remember it, don't forget it, note for next time, move on. But I have such a hard time moving on, and I'm like, how do people, somebody give me advice, please. I need to stop holding on to things because I will burn out, and I don't want to burn out. I want to still be happy and not stressed all the time, but I feel like I'm becoming more stressed and scared and panicky now, and every day I'm like, ah. So yeah, if anybody has any tips that would help, but also hopefully this also comforts people that kind of still feel the same way, and I kind of hope that people in my position still also kind of feel the same way so that I'm not alone. But yeah, it's kind of rough out here. It's definitely, you know, once again, it's a testament to the growth that you get from medical school. Like, I definitely feel a lot better as a resident. I feel more confident in being like, I want to order this, I want to do this, but still, like, you're supposed to learn stuff along the way, but it's still panicking me when I have to learn stuff along the way. I guess also because family medicine is a 2-year residency, and I'm like, listen, man, if I also do like some emerge or hospitalist or something after I finish these 2 years, like, I need to get it together. So
y'all, I just had one of my attendings look me in my face and say that I sounded dumb. And before y'all ask, no, it was not a joke. It was not a joke. She was dead ass. She said it multiple times. So a little quick backstory. I am currently on my cardiology rotation, and we were seeing a patient in the emergency room who had come in with issues with like shortness of breath. Essentially, he is in heart failure. And so as I'm presenting the patient, I was mentioning that the patient has a bioprosthetic heart valve. And I called it a cow valve, which is what the emergency room attending put in his note, which is what I had reviewed prior to presenting. So I wasn't the first person to call it a cow valve. The attending was. So my cardiologist attending is listening to me present and became offended because I said cow valve. And basically she said, "You sound dumb." And there was no smirk, there was no laugh. And I was so taken aback because in that moment I was just like, who are you talking to? Who talks to other adults like that? Or think that it's appropriate to speak to other adults like that, especially in the workplace? Like, we're not friends. You're my supervisor and you're teaching me. So essentially she went on and on about how I had used the wrong term for the valve, and apparently cardiologists call it a tissue valve. Okay, girl, it's a tissue valve. Like, it's not that deep. And she proceeded to belittle me on my physical exam findings and all these other things, and it was just not a good time. Like, it did not make me feel good at all. And it just reminded me of this overarching problem in medicine in terms of toxicity. Medicine can be so toxic because there is this kind of hierarchy in medicine where essentially the medical students are at the very bottom of the totem pole, and then interns are here, residents are here, then you have fellows and then attendings and so on and so forth. The hierarchy can get really bad because it feels like certain people at certain levels in their career, like attendings for instance, feel like they can belittle the people below them, even as they try to frame it as teaching. Honestly, like, this doesn't happen very often at my program. I'm very blessed to be at a program where like people are very collaborative and the attendings are very nice and they actually want to teach, but every now and then you're reminded how toxic medicine is, and it can really get to a lot of people, especially residents. Essentially, by nature of where I'm at currently in my career, by being a Black woman, being a Black female doctor, I've had to develop thicker skin. So I mean, what she said earlier kind of just, I don't know, it rolled off my back. Like, it is what it is. But I mean, that doesn't take away from the fact that it was wrong and inappropriate. And what if she said that to someone that wasn't as, I don't know, emotionally stable, someone who did not have as thick skin? It's just unfortunate that the medical environment breeds toxicity like this, because this is supposed to be an environment of healing. But that is not always the case, especially for interns, residents, fellows, anybody going through training. Check on your resident friends.
I appreciate you guys watching the video today. Please make sure to like, comment, and subscribe down below, and I'll see you guys in the next video.